Good evening, everyone. Can you hear me okay? This is Rhea, and I'm from Wysa. In the next 5 minutes, I'm going to tell you a story about how artificial intelligence can actually save lives. Maybe I'll ask raise your hands if you or someone you know has actually been diagnosed with a mental health condition, like anxiety or depression in their lives. Maybe join in and raise your hands if you've ever been in therapy or sought any form of professional help. And then lastly, I guess, raise your hands if you've ever just felt really stressed or panicked or, I guess, just really lonely at times. Well, I can assure you that in this feeling, you are not alone. Because 1 in 3 people globally around the world feel isolated and lonely frequently. And we now know that this increases the risk of premature death by 30%. But more alarmingly, every 40 seconds, someone dies by suicide. As someone who lives with depression herself, even for someone with my privilege, it took me years to find the right mental health support for myself. Why is it so hard? Well, there aren't enough psychologists, therapy is too expensive, I didn't know my options, I didn't have the agency, nothing felt culturally relevant, it was too late, I didn't like it, and there was stigma. Mental health is a really wicked problem to solve. But I'm going to shatter these. I mean, literally, shatter them. Because at Wysa, we have overcome every single one of those access barriers. It starts with a safe space and a conversation, much like the one on the screen, where a person is able to reflect and really share all of their thoughts and feelings in a way that is non-judgmental and zero stigma and 100% anonymous. This is support that is 24/7. Available anytime, anywhere, and truly feels limitless. This is done in a way that builds trust because it's clinically effective. Wysa is built by a team of therapists and modeled on techniques like cognitive behavioral therapy. And all of this is done using responsible AI. AI that is deterministic, rule-based, and has crisis escalations built in. Ultimately, people open up to Wysa's AI 3 times faster than they do to a human therapist. An independent RCT published earlier this year proved Wysa's clinical efficacy and showed a 40% reduction in depression symptoms, very similar for anxiety. And this was a whopping 12 times greater reduction versus treatment as usual in just 4 weeks. We know this solution works. We know this through tens of real-world evaluations and clinical trials done with some of the world's leading institutes, as you see on the screen. Till date, Wysa has served 6.5 million users across 95 countries and consistently had a greater than 90% helpfulness rating amongst its users. We've also got global recognition from the likes of the FDA, World Economic Forum, and our favorite was when Bill Gates gave us a shout-out last year on his blog. But the story has to continue, though, which is mental health is a human right and something that cuts across all the sustainable development goals, much like every single venture here spoke about across different domains. Which is why we're taking this cost-effective, scalable, and life-saving intervention to all of India and truly meet people where they are. We're going to do this in 3 important ways. 1, we're building Wysa in Hindi and Marathi and 10 more regional languages next year, and taking this not just in a mobile application, but across platforms such as WhatsApp to truly reach millions of more underserved Indians. We're going to deliver this in a hybrid model in partnership with community-led programs nationally. And thirdly, as Chiru said, we're going to do the difficult thing and work with the government at both the central and state levels to be able to make this sustainable. Let's go back to the start. Every 40 seconds, someone is dying by suicide. But there are at least 20 more attempts at suicide to every 1 death by suicide. And by giving Wysa in the hands of an individual, we are potentially saving a life. Today, Wysa is being used by some of the leading public health systems in the world. For instance, the Ministry of Health in Singapore today offers Wysa to all of its citizens. And we're backed by multiple impact players, much like so many of you in the room today. And my request is to join us in our mission to support specifically 10 million young people in India by 2030, for which we are raising $5 million in grant funding. And that is the story of how artificial intelligence can save lives.